Is your pregnancy at risk of preterm delivery? Or do you have a previous preterm birth? I am Dr. Haliza Kamarudin. I am a Consultant Obstetric Gynaecologist in KPG Damansara 2, and I have a special interest with preterm birth prevention and treatment. So today I would like to talk to you about Shirodkar Cerclage, which is a life-saving method that we use to help to prevent and also as a treatment for cervical insufficiency. So preterm birth we can classify it as late and early. So early is anything less than 32 weeks, or late is after 32 weeks. So as you know, the earlier the gestation, then there's more repercussions to the baby. Thus, we would like to prevent those deliveries from going for preterm. So when we see preterm deliveries who are we see there's a number of causes for preterm delivery. So number one could be infections. When they have undiagnosed infections and they don't get treated, then they might have preterm deliveries. Number two, they might have a very traumatic birth in their first pregnancy that resulted in a trauma to the cervix that resulted them in having a preterm delivery in the subsequent pregnancy. And number three, they could have also a very weak cervix. They're born with it, a weak cervix, which is called idiopathic cervical insufficiency, that result in preterm birth. So a cerclage is a procedure where we tie the cervix. So there are several methods of cerclages, which includes McDonald, which is the most common, that's done worldwide, Shirodkar, and there's also abdominal cerclage, which is you need to do an open operation in the abdomen. Yeah, but so what we specialize in is called Shirodkar Cerclage. So we specialize in this technique called a Shirodkar Cerclage. So it's a different type of method of cerclage than the rest, as it's a higher cerclage where we need to do a dissection, and we tie the cerclage using a special tape to tie the cervix higher up. So in our center, we have 87% success for patients to go up to 37 weeks of pregnancy, and our 97% of patients going to more than 34 weeks of pregnancy. And we have now 82 patients who went to give birth at term with this method of Shirodkar Cerclage. I always say it's always a sign if you have vaginal bleeding on your second trimester, and that's not normal. So if you have any bleeding in your second trimester, please seek immediate help. It can be detected early and it can be prevented. If you have any symptoms of preterm delivery, such as vaginal bleeding or any water that's coming out from your vagina, or any cramps, please seek immediate attention to the nearest health facility.